If your knee or hip pain is changing the way you live, stopping you from walking, sleeping, or doing normal things, it's not just aging. And the question isn't how much it hurts. The real question is, what is it costing you? I'm Dr. Donald Hope, and in this video, I'm going to walk you through what I call the replacement stage check, a 4-part framework that tells you exactly when joint replacement becomes the right conversation. The first sign is that pain shows up during ordinary moments, not after a hard workout, not after a long day on your feet. We're talking about getting out of bed, walking through a grocery store, going upstairs, standing from a chair, getting in and out of the car. When pain follows you into those moments, your joint isn't just irritated, it's limiting you. That's the shift that matters. The second sign is stiffness. Your joint no longer moves the way it used to. Your knee won't fully bend. Your hip feels tight when you put on your socks or your shoes. You start turning your whole body instead of moving naturally. This happens because worn cartilage and joint damage reduce smooth motion. So even when you try to push through, the joint keeps reminding you that something deeper is going on. Here's one most people miss, and it's the one I pay the most attention to. Your world starts getting smaller. You stop taking walks. You skip trips. You avoid family events. You think twice before parking far away. You sleep poorly because your joint aches at night. You become less active, then weaker, then even more uncomfortable. That cycle is real. And once pain starts controlling your choices, your quality of life is already being seriously affected, whether you name it that or not. Now, a question I hear all the time, do I have to wait until it's unbearable? No. That's outdated thinking. Joint replacement is not reserved for people who are completely miserable and barely moving. The best time to have this conversation is when pain is consistently interfering with your life and you know you're not living the way you want to. The fourth sign is when the treatments stop working. Anti-inflammatories, injections, physical therapy, rest, activity modifications. When those stop making a meaningful difference, not just a bad week, but a real plateau, that tells us the joint has moved into a different stage. You're no longer dealing with a flare-up, you're dealing with advanced joint disease. And I want to be clear about something. Replacement is not giving up, it's giving your life back. The goal isn't just pain relief, it's restoring movement, sleep, confidence, and it's the ability to do normal things without your joint being the first thing you think about every morning. If your hip or knee pain is limiting your movement, disrupting your routine, and keeping you from living fully, it's time to stop guessing and start the conversation. If this helped you understand the signs, hit like and subscribe. I post regular videos to help you make confident, informed decisions about your orthopedic health.